Welcome to this webinar. We could use lots of adjectives to describe these last 4 months. All of us would probably say confusing and challenging. Most of us would add exhausting, but many would also say traumatic. As we move forward as a culture, the church needs to be ready to walk with people through their healing from various forms of trauma: physical, emotional, social, spiritual, societal. To help us prepare to do that, I reached out to Mrs. Dana Henry and Dr. Anthony Asako. Dana is a licensed therapist in Swickley, Pennsylvania, and a member of St. Stephen's Anglican Church. She and her husband, Bill, one of the priests at St. Stephen's, also lead a marriage ministry. She'll be sharing insights around trauma. Anthony is a professor and the director of training for the Doctor of Psychology program in the School of Health Sciences at Chatham University. He works with the Anglican Diocese of Pittsburgh, providing psychological assessment for those who are discerning a call to ordained ministry. Anthony will be talking about grief and sharing resources. Let me turn it over to you, Dana and Anthony, and thank you for being willing to share insights about ministering to folks who've experienced or are experiencing trauma and grief.
When you look at trauma, trauma is a very subjective experience. And all the families and the people who you are shepherding through this have had very individual and subjective experiences of being quarantined, losing jobs, putting together puzzles, watching friends and neighbors go to the hospital, some who didn't come home from the hospital, having endless Zoom meetings, parents who become teachers, friends and family trying to connect without being able to see each other in person. So trauma, as we look at it, is a subjective experience and reaction to a real or imagined threat to a person's sense of life and safety. And literally, the word trauma means wound. So most people think of trauma as something big, and I call those capital T traumas. A shooting, violence, going through war as a soldier, a plane crash, severe cancer, and sudden death. So these are big T traumas that people normally think of. But trauma is also little t traumas, such as a child losing a favorite toy for several days and not being able to sleep, a car accident, a husband using the word divorce, being bullied and made fun of in the 3rd grade, someone without a mask, sneezing next to you in the supermarket. These are all little t traumas. And the body responds to big T traumas and little t traumas in just the same way. So when I use the word trauma, I want to be very clear that I'm not talking about big traumas, because our bodies experience those little traumas just the same way. I'm going to be drawing from the woman who I did all of my training under for EMDR work, which is a trauma therapy, and counseling within a trauma framework. And her name is Dr. Jamie Marich. And the explanations and framework that I'm going to be using are taken from what she taught me and from her materials that she gave me. So in order to understand trauma, it's important to understand our brains, because trauma first happens in the brain. Now I'm going to use my fist here. If you want to do this with me, you can follow along with me. My thumb is going to be underneath my fingers. So this right here is your brainstem. And the brainstem sends information about what's going on in your environment right to this next brain, which is called the limbic brain. You and I right now are in the limbic part of our brains. It's the here and now. Dogs have the limbic brain. They always live in the here and now. And immediately what happens within the limbic brain is there's something called the amygdala, which senses danger and which tells your body if you're safe or you're not safe. Right now, you're probably feeling safe, I hope. And so information is going right from your limbic brain right to your prefrontal and frontal cortex right here. And that's your processor. That helps your brain to process and store or just kind of forget about the information that you're learning. Once that information is processed, your brain says, okay, good, I'm good. So this experience right now of learning about trauma will probably not be traumatic for you. But then when something traumatic does happen, like let's say a plane crashes into my building. Right now, my brain stem would give the information to my limbic brain. The amygdala would say, you are in danger, and it would immediately send word to my body that I am in danger. Fight, flight, or fight. Fight, flight, or freeze takes effect within the body. And when that happens, all the blood rushes from every part of you, every extremity, including your head, to your core, which gives you that power, that superpower as your heart starts beating fast and you start to breathe fast, that you need to fight for your life, you need to flee, run away, or you freeze. Whatever your body and your brain is going to tell you is the most instinctual protective measure. These reactions happen to all of us, sometimes every day. Sometimes things scare us every day. What happens with trauma is when the amygdala says there's danger, the frontal cortex, the processor, goes offline because there's no oxygen. Oxygen flow is depleted to go to the core. So information is not sent to be processed to the brain. So that when that person is not activated anymore and that brain is calmer, that information is now stuck in the limbic part of the brain, the here and now. It has not been processed and stored and put away as either this has been scary or I am safe. So that person remains scared and activated in that limbic part of the brain indefinitely. Now, what happens with trauma is that the person who has trauma stored in the limbic part of the brain, which is all of us because we all have trauma, begins to re-experience these events as if they were happening in the right here and right now. The same fear, same emotions, and same physical reactions they had at that original traumatic time. It's like a soldier who dives under a bench when he hears a car backfire. It begins to weep and shake, believing that he is back on the battlefield. His brain is telling him that his danger is real and present. So unhealed trauma is completely debilitating. Now I'm going to give you an example of this. There's a child, he's in the first grade, and all of a sudden in the first grade, the fire alarms start going off because there's a fire in the cafeteria. The rooms begin to fill with smoke. The teacher takes the children out to the yard. Fire trucks show up. There's hoses. It's loud. And that child, his processor goes off, and he sees around him danger, and he believes that he is not safe. I am not safe. And so associated with that memory is the belief of I am not safe. And because he went into fight, flight, or freeze, and his processor went offline, he is stuck with that I am not safe memory within him. Now fast forward 40 years, where this man is sitting in your church parking lot having one of the first Bible studies that you're trying to put together after quarantine has been released. We've been released from quarantine. The person next to him touches this man's Bible. Another person within the group who chose not to wear a mask sneezes and coughs. And so what happens is this man says, wait a minute, I'm not safe. And as soon as that happens, that information is delivered to that man's brainstem, the amygdala says, I'm not safe, and that unprocessed memory is then released, and it's activated. And just like that soldier, that man is reliving those memories, that memory of that fire in the first grade of I am not safe. And so what he does, because he's got those same emotions, same feeling, he marches up to the pastor, and says, what is going on? I'm going to sue this church. I am not safe. You are not keeping me safe. What is wrong with you? And he reacts with a total, seemingly irrational behavior. The amygdala was in control. The body was now in control. The false beliefs that he had completely took over, and he wasn't able to be rational. Because again, he was experiencing fight, flight, or freeze, and his processor went offline. We all have this happen to us. We all have trauma. No one escapes it. It happens to everyone. And with COVID, fear and safety can be the big themes of what we've gone through. I'm sure there's many other different themes, but fear and safety are the big themes that can be seen through COVID. The fear of death was so real for most of the world, even in America, when most of us, especially those of us with privilege who don't have that. We don't have that fear of death. For some, this was the first time they feared death. And for others, the pandemic has triggered trauma from their past. And as you continue shepherding and supporting your flock through this healing process from these traumas, it's important that you know that and understand and be aware of that you as the pastor, the pastoral care person, are also experiencing your own trauma during the quarantine. And so if you're realizing as I speak that, oh, this is hitting me, I've got some beliefs that are taking over and I'm believing things and I'm feeling out of control of my emotions around this, I want to encourage you to do your own work, perhaps with a therapist, as you work with the people in your church. So when a person comes to you and seems to be overacting or irrational, so fearful, so afraid, sometimes so agitated and angry, especially about a situation that might be related to COVID, that might be related to what's going on now in the church, our current situation in our culture, I want to recommend that you listen to them. Just listen to them. And you might want to ask them, what is the belief that you have about this situation? And you might offer, I'm in danger. I'm not safe. No one listens to me. I'm not important. I will never be safe. I can't trust anyone. Nobody takes care of me. And those are beliefs that they have about themselves that are probably related back to a previous trauma. And then you might want to ask this person, does this situation remind you of something from your past? Now, the brain has been waiting for this for years. The feelings have been telling this person, highlighting there are feelings. And the feelings are pointing to these past traumas because that limbic brain keeps highlighting them. So when that man says, well, yeah, I had this situation. I remembered I was in the first grade, but it's so silly then. I mean, come on, that's nothing. That's where you say, that's that wound. That's where that trauma wound happened. This is the place where Jesus can come in. This is the place where that person can receive that healing so that the brain can begin to process and work through these memories so that they're not triggered anymore, so that they can experience freedom and release and healing. Some of the symptoms that you might find with people of unhealed trauma that you might see related to COVID, and remembering that trauma can be defined as a real or imagined threat to life and safety. These symptoms might be isolation and withdrawal. You notice that people, they're not coming back to church. They haven't engaged in any online events. They're not responding to communications. They really don't want you to ask where they've gone. And you might want to ask these people, what are you thinking and believing as you try to reconnect with them? Many people were alone without human contact for over 2 months, and this can be devastating to people. We need people. God created us with that need for other people. So look for those people who are isolating and withdrawing. Might be a symptom of something deeper going on. Excessive weight gain. There's a real thing called the quarantine 15. Food is often a very normal, healthy, pain-numbing agent. If I can eat a half a bag of barbecue potato chips, I can feel better. Food will numb the pain. When uncomfortable emotions come up, our brains, one of the biggest function of our brain is to avoid pain. And so the brain wants to avoid emotional pain, so it's learned that half a bag of chips might do the trick. Let's get a lot of ice cream. Let's just eat because this will numb my pain. There's also an increase in addictions that's been documented, because when the brain senses danger or pain and wants to numb it, alcohol, drugs are a convenient way to do that. The alcohol consumption in March was seen to be 50% over what it was in March of 2019. People are drinking a lot of alcohol. You as a pastor, a pastoral care person, might have been drinking a lot of alcohol during this time. Other addictions that have been able to increase are gambling and pornography, because you can just look at your phone, it's right there, and everybody had a lot of time to spend on their phones and on their devices. So it's important to note as well that most addictions are a result of unhealed trauma. If you treat the trauma, the person does not need to medicate that pain, because the pain in the memory has been processed, and the brain can see that that happened to me as a child and I am safe now. When trauma happens, it believes that you're not safe and you're never going to be safe. And so addiction is a great sign of trauma from the past. Another symptom you might see is complete denial. I'm fine, even when it's pretty clear from looking at a person or spending time with them that they're just not fine. Denial is a protective mechanism that protects the self from pain. If I don't acknowledge it, it didn't happen. You can look at other numbing behaviors, social media, TV, Netflix. There's a big difference between checking out for my job a little bit to spend some time on Netflix, or I'm going to watch 6 days of TV because I don't want to deal with the pain of losing my job. So looking at how they're spending their time at home. Poor sleep and fatigue, anger, aggression. Notice marriage and relationships. If there was stress in the marriage before COVID and quarantine, in many cases, these marriages can be in a worse place. In my counseling practice, several affairs had been exposed during quarantine because there's nowhere to hide. Struggles through parenting and schooling children, breakdowns in communications. These are all things that you can look for in the people you're working with. And then anxiety, which is so important. I can't tell you the number of past people who've come into my office saying that their pastors told them that anxiety is a sin, and they're really not a child of God if they're anxious, because they're not trusting the Lord. The unknown is a huge trigger for traumatic memories in people. The unknown is a trigger. Food and shelter insecurity, job loss, children not having graduations, being able to go back to school. Have compassion with these people who are so anxious. Validate their feelings. Seek to understand. Ask, does this remind you of something that happened to you? It's a really simple question, which might take them back to that unhealed wound. It's important to let them know that trauma is normal and these feelings are normal, and that you can help them to get the help that they need. The Lord knows all of our wounds, emotional, physical, and spiritual, and our intellectual wounds. He was there when we received those wounds, and He does and will heal them. Be ready with the resources that Anthony's going to provide and more. Talk to different pastors from local denominations, asking them how they are working with their people. Do a lot of listening and validating for both the big T traumas and the little t traumas. And as you seek to teach your people how Jesus can meet them in their wounds and heal those places of hurt and fear. And that's all I got.
Thank you. Yeah. So, Anthony, you want to pick it up from there?
Sure. All right. Dana, thank you so much for that presentation. One of the reasons I like presenting with other people is I learn so much, as I did with your presentation. And when we were talking about this topic, we both knew the overlap between trauma and grief. And so these topics often go hand in hand together. And so there'll be some overlapping information, but complementary information as we viewed it in this process. And I hope to add a little bit more onto the resilience side and resources side of things that will help in ministry. So what is grief? We've probably have all had some experiences with grief, either personal or to people that we know, but grief is an expected, normal, but very complex emotional reaction to an experience of loss. So grief is, as I would say, is just a part of life. We all experience grief. We've seen it, we've gone through it, we've helped people in moments of grief as well. And so there's definitely a lot of grief right now in the world. And I wanted to talk a little bit about grief related to COVID-19. And so, of course, the top source of grief whenever it comes to COVID-19 is a loved one dying from the virus. And researchers and medical professionals are considering COVID-19 deaths to be quote unquote bad deaths. And so what do they mean by that term, bad death? Well, it means that the symptoms that come on from the virus are so distressing, the difficulty breathing, the fatigue, the unexpectedness of the disease and the virus is in sharp contrast to what medical professionals will refer to as a good death. A good death is whenever someone is comfortable, they're surrounded by loved ones, they have somewhat prepared for and expected for the inevitable passing. And so when you have a bad death, that name pretty much says it all, and that the grief is then only compounded by the physical and psychological distress associated with this virus. You have other sources of grief during this time that Dana mentioned as well that can also cause trauma, either big T or little t traumas. You have unemployment. So much of one's identity and way of providing for themselves and for their loved ones is tied to their employment. And if you remember back before March 5th or so, the economy was going really well. It seemed like it was an unstoppable positive force. It was good times, so to speak, with the economy. And then since then, we have unemployment in the millions. I think the Pew Research Center issued a recent document saying that it's about 16 to 20 million people have lost their jobs since March. So you have a high volume of job loss in a very short amount of time. And with a job loss, you are then grieving your identity as an employee. You're grieving the financial impact on you and your family. I've known clients, friends, family members who've had to move to different states in order to find a new employment. And that in and of itself is a grieving process. The transition away from one's home to a new place of work. Grieving can also be seen in those who are working too much right now. You know, those on the front lines, the healthcare workers, maybe yourself as a minister, where you're now plugged into your computer doing Zoom call after Zoom call, you know, feeling like you need to be on the front lines and working so much. I know I have some friends, colleagues who are nurses, doctors in hospitals, and it's like they never seem to be able to turn it off and are getting to that point of burnout. A marriage could end, as Dana alluded to. Infidelity, conflict, divorce, separations have been increasing during this time. When Pennsylvania went to the green phase, there was a significant uptick in calls to domestic violence organizations. And so that is also a source of grief when there's, of course, violence and a marriage ending or conflict in the marriage. I also like to point to just how there's like a low-level grief of we are living in a different world right now, and there's a longing from people to get back to normal. I wish I had a nickel for every time someone told me they just want to get back to normal. We're now in June, normal ceased in March, and we're still not back to normal. And that in and of itself is a source of grief in the sense that people want to get back to normal. And related to that is people have a spiritual religious disengagement. They are missing their place of worship. They're missing their religious spiritual community. They're missing going to church on Sunday and seeing their minister, their priest, their friends in their community, and they're grieving that loss. So how is COVID-19 grief different? And this is a quote that I pulled from an article that I read this morning, in that you have grief that is compounded by the erosion of what we consider to be typical resources during times of grief, which is social support. You have social isolation, financial precarity, uncertainty about the future, lack of routine, and the loss of face-to-face mourning rituals. Those are all things that can provide a sense of community uplift that can buffer against the negative aspects of grief and are missing during this time of COVID-19 grief, which is further contributing to that term that these COVID-19 griefs are bad deaths, bad grief, quote unquote. So reaction signs and symptoms of grief are all on the left-hand side. These are all very familiar to us. I'm not going to spend too much time going through all of those symptoms. What I wanted to spend a little bit more time on is that kind of rudimentary graph I put together on the right-hand side, which as a minister, for yourself and for ministering to other people, this can give you a little bit of a guide in terms of how you can help people with their grief during this time. If you look at the graph on the left-hand side, you see kind of the normal kind of reactions to death and loss, which is sadness, crying, being a little avoidant and withdrawn. And that is a normal emotional reaction to loss. And that's what I would call normal grief. And normal grief can be dealt with normal things, simply taking time, praying, having some space to reflect and to regroup, journaling, basic self-care activities, friendships, and social support. If you move a little bit further along in the graph, you see then distressing. All of those things on the normal side are important during it, when grief might elevate, so to speak, to a distressing point. But then we need to start to think about how other resources can help those we're ministering to. So this might be a good time for pastoral counseling or accompaniment, a little bit more involvement from a pastor. A support group. Lots of congregations have grief support groups, and it might be a good opportunity to recommend that to someone that you're ministering to. And it also might be a good time whenever mental health counseling is appropriate. And what I mean by distressing is when you start to see signs that these symptoms, these emotions are becoming a little bit more debilitating. The person maybe isn't able to leave their house. They've withdrawn now for a longer period of time of what we might expect. They're not able to work whenever they have worked before. They have reached a point where you might notice, boy, they are off at this point. They're not their normal selves. And then on the far right-hand side is whenever grief might transition into a clinical depression. Clinical depression is something where a deeper set of sadness and loss of interest in normally pleasurable activities sets in for about a 2-week period. And here the person just simply can't pull themselves out of that funk, that grief. And here mental health counseling becomes a priority. So in terms of some ministry ideas for a new time, first of all, I want to make clear that despite our state considering church and clergy as non-essential during this pandemic, I take the opposite opinion and consider clergy and church to be essential parts of our way of life. And ministry ideas, to me, should focus on kind of two broad kind of themes, which is presence and accessibility. People want their church to be accessible to them, and they want their pastor to be present and accessible as well. And that might not be the old way of in-person meetings and gatherings, but that doesn't mean you can't still be present and accessible. So the top way that healthcare workers and researchers are kind of doing a workaround, so to speak, is the use of technology. And we all have to be comfortable to some degree at this point. The nice thing is the low-level technology is a simple phone call. There's been now a renewal of phone call ministry. People reaching out, doing check-ins, doing support groups, conference calls, all with a phone call. So those of us who might not be high-tech people, we at least know how to use a phone and know how to call people. And that is a low-hanging fruit that we can all kind of engage in. Some of the more high-tech kind of resources and ministry ideas that have emerged have been the use of technology to live stream services, live stream sermons and record, podcasts, YouTube videos. When grief is specifically involved, virtual funeral services have emerged. As Dana can attest to, telecounseling is a new norm right now. So the access of a good counselor is taking place over virtual means as well. And then what I call open air ministry, a lot of parking lot and drive-in, drive-up ministries that are getting people back to the place of worship, which I think is really important, but in an open air setting. I think the other thing that we can do in ministry is just take advantage of the fact that we are in the green phase and pray that we don't get into a second wave of COVID-19. So for me, I would encourage you to be open to new creative ways of ministering to other people and embracing either low-hanging fruit technology like a phone call, or maybe challenging yourself to develop some technology skills and minister in that way. The other thing that's within the wheelhouse of pastors and ministers is improving the resilience, growth, and healing of those you minister to. This is exactly within your area of expertise as a minister. When people experience grief, they need help making meaning out of their experience. They need a spiritual perspective on the matter. It's an opportunity to deepen one's relationship with God. You can certainly sit with and just help the person accept their new reality. All of these things go into building resilience. Of course, grief is difficult. It's complex. We don't want to minimize the experience of grief, but it's also an opportunity to grow and to heal and get to a new place of perspective. One of the best ways that people can get through grief that you can kind of facilitate as a pastor is helping that person who's grieving help someone else. It gets them outside of their own perspective and their own kind of bubble of grief, and allowing them to kind of engage in some reciprocal help for someone else who might be having a challenging time. And then the last thing that you can do, which I'll talk a little bit more about before wrapping up, is the refer and educate. As you maybe minister to someone who's experiencing more difficult feelings of grief, you might need to refer and educate that person to further provide support. So I have different categories of resources around this topic. I'm not going to go through every single one of them, but I will give you the broad kind of buckets and point out some specific ones that I found particularly helpful. I'll start with websites. Most of us use the internet and surf the web and know what websites are all about. So some of the more beneficial websites that I have found, when it relates specifically to trauma, there's the National Center for PTSD, a comprehensive website that gives lots of good information on what is PTSD, resources for it. It has a consultation service as well that you can call in or email in for a particular consultation. It has videos that explain what PTSD is, treatment options. It's really a multimedia platform. It's all free as well. The Center for Advanced Palliative Care has a toolkit for COVID-19 responses and resources that I found helpful. Goes through lots of different ways that we can engage in self-care as people who are on the front line, but also resources to build resilience in others. The American Psychological Association has good information on trauma and how to talk with and work with children and adolescents who might be experiencing trauma as well. Most people have a smartphone and therefore have apps, and so apps can be really helpful. I got most of these apps from this website that's listed below that gave 25 of the best mental health apps. I just pulled out a few that are specifically related to what we're talking about today. There's the PTSD Coach app, which again, download onto your phone. It's free education and information on PTSD, trauma for kids, relationships, people in your family. The VA department developed a specific COVID Coach app, which is also free, which is meant to help with the daily stress and building resilience, specifically in response to the COVID pandemic. And all these other ones that I have listed here are free as well, so that's a nice benefit to these apps. And I'd like to just point out the Mind Shift one, which is specifically for teens and young adults dealing with anxiety. So it's nice to have some resources for younger people as well. Books that you might find interesting. I give you a whole list here. The two in blue are ones that I consider the classics when it comes to trauma. The Body Keeps the Score, Brain, Mind, and Body, and the Healing of Trauma. Dana did a wonderful job of talking about the mind-brain connection when it comes to trauma, and this book, I think, kind of fleshes that out even more. And so it's considered like the top book in terms of the trauma and the mental health field right now. And another kind of, I think 1A and 1B then is Trauma and Recovery, the Aftermath of Violence, from Domestic Abuse to Political Terror by Judith Herman, considered a classic in the field around trauma. Very readable, very accessible text that I recommend a lot to everybody. So those two books would be my top recommendations, but all of those books are good. And then whenever it comes to mental health referrals, these are for yourself. These are for people that you minister to. Dana and I sat down and came up with a list of people that we often refer people to. This is not an exhaustive list, but these are some of the counselors that we refer people to on a regular basis around the Pittsburgh area. I gave their name, phone number, and the general area in which their office is located. But again, in this time of telecounseling, geographic region might be a moot point. At the bottom of the slide, I also give you a website called psychologytoday.com. There you can go on that website, and it has a robust search function where you can search for a therapist in the Pittsburgh area by several different search criteria: health insurance, geographic region, the specific clinical issue that's being dealt with, as well as faith background and faith orientation of the counselor. So I find that search function to be a very useful tool in my practice, and I recommend that as well if you want to do a self-directed search. Here's some of the bigger Pittsburgh-based mental health organizations. Obviously, two of the bigger ones are Western Psychiatric Institute and Clinic, which is part of UPMC, and then the Department of Psychiatry and Mental Health, which is part of the Allegheny Health Network. Both those are kind of medical, hospital-based services with various departments that kind of offer the full range of services for mental health issues. Really too many to get into right now, but on the website kind of breaks down all the various departments and institutes and centers that they have within those big organizations. And I just wanted to wrap up with then some referral tips. If you are making a referral for someone that you're ministering to a mental health counselor, just a few key points here. When you call someone to make a referral, be prepared to leave a message and get a call back. Rarely, whenever I call a counselor for a referral, do they answer the phone. Usually it's because they're in session with someone. And so then they will call you back during their lunch hour or in between sessions or later that day whenever all their clinical appointments are wrapped up. It's okay then to call a few counselors at once. Several counselors I know have full caseloads right now and are operating on a waiting list. The demand has increased over the last few months because of all these issues that we've been talking about. So it's good to call a bunch at once. About last month, I was calling some counselors to make a referral for a client that I was working with. I think I had to call about 10 before I got a call back from someone. So the demand has increased, and so it's important to have several options available. When working with the person you're ministering to, it's important to kind of clarify how they plan to pay for the mental health counseling. Either it's out of pocket, cash, health insurance, and then to clarify what behavioral health benefits they have with their health insurance plan. That can often go a long way towards building a stronger bridge between that person and the appropriate counselor. And then clarify with the person if they prefer in-person or telecounseling and what's being offered right now. Some counselors are going back into the office for in-person meetings. So that is happening right now in the green phase, but that's not universal, and it's being done with caution and face masks and social distancing and all those guidelines. And then lastly, you might want to discern the role of faith for the person in mental health counseling. Do they prefer a Christian counselor or not? For me, I obviously believe in the importance of faith integration in mental health counseling, but whenever I'm making a referral, I first and foremost want the mental health counselor to be a competent counselor. And sometimes they might not have the faith background that's desired by someone in your congregation, but they're a very good counselor first and foremost, and are at least respectful of one's Christian faith. But if the role of faith is kind of the first and foremost kind of most salient factor, then that could be something that you ask about when you talk to the counselor over the phone. What is their attitudes, beliefs about faith? How might that be worked in or not worked into counseling? Just so everyone's on the same page and there's kind of an informed consent process to all of this. So I thank you very much for your time, and I'm happy to answer any questions that might be out there.
Thanks, Anthony. Thank you, Dana. While we're coming back, a question for both of you. I was struck by two things. One is how helpful it was just in terms of thinking of ministering to others. But the question that came to me is, what would be one or two or three questions that you would ask in a mirror, looking at yourself, like to get a feel for, am I in trouble? Like, is trauma affecting me more than I think it is? Or am I pretty deep in grief and I'm finding myself struggling in ways that maybe I don't want to recognize or can't recognize? So what would be a couple of like in the mirror questions that you would have people ask themselves, the caregivers ask themselves, to see if they need to get some help?
I would really kind of first check in with, most importantly, what does my relationship look like with the Lord right now? How am I spending time with the Lord? What am I learning? How am I growing? Am I able to learn? Am I able to grow? I might also look at how am I doing in my relationships with the people who are most important to me, my immediate family, my very closest friends. And I also might check in with them. How do you see me? Do you see me as being healthy right now, or do you see me, experience me as perhaps being in an unhealthy state right now? And then for me, I know as a clinician, I always have to ask myself if I am feeling my own feelings or if I'm just spending time being a voyeur into other people's feelings and having my needs met through those other people. That I have to attend to my own feelings with the same passion that I have to attend to others. And if there's imbalance in that, it's going to be unhealthy. Either way, it's going to be unhealthy. So I'd say those are the three things that a pastor, somebody in pastoral ministry, and clinician could definitely ask themselves.
Good, thank you.
Yeah, the relationship piece is very important. I would 100% agree on that, Dana. And I would add that for me, there's kind of two telltale signs that I might be in a place of imbalance. One would be my sleep routine. So if I'm staying up later, if I'm not getting to bed at my normal time and then having a harder time waking up in the morning, that's a real kind of sign that something's off, and I need to take a deeper look at what that is and how to recalibrate. And then the second sign is my exercise. And so if I'm not exercising, if I'm finding excuses not to exercise, if I'm talking myself out of exercise during the day, then that's also a sign that something's off with me emotionally, spiritually. And I need to, again, take a closer look to kind of identify what that is and do what I need to rebalance in those areas.
It seems to me that this is one of those seasons, a little bit like the talk you get on an airplane, that in case you lose cabin pressure, it's like, but if you're traveling with someone else, make sure to put your mask on first before you try to help others. This seems to be one of those we've lost pressure in the cabin seasons. And that those that are giving care probably should be connected to somebody who's caring for them, whether it's a therapist or a spiritual director or some kind of spiritual friendship, that has an intentional, consistent component to it. It definitely strikes me like this is we've lost pressure in the cabin season.
I'd agree.
Absolutely. And that's exactly the metaphor I use with my counseling students, is that if you're going to be training to help other people, you need to be able to help yourself first, because you need something to give to that other person. You can't give what you don't have.
And also there's such an inclination, because clergy, and my husband's a clergy, member of the clergy, and he felt just so defeated for so long and just so stuck because he couldn't do anything. He could call people. And then as soon as green phase opened, well, I didn't see him. I mean, he was working. He was doing what he was trained to do. He was doing what he wanted to do. And so there's this idea that now we have to do it all. And again, there's an imbalance there. And so really kind of coming back to, okay, what is this going to look like in a day-to-day? What's healthy? What was I doing before COVID? What do I need to tweak to do this differently? But to pay attention to really to the amount of time and energy you're spending at work as opposed to with your family and on yourself.
Yeah, it's not going to be possible to make up for 3 months of work and attention and care. And yeah. Was there anything last thing you would want to share with clergy and caregivers? One last thought.
I think for me, just to reiterate what I said during the talk, which is church and clergy are essential to people's health and well-being during this time, and you definitely have a role, an essential role to play, and people want to get back into their place of worship. They want to be able to see their priest, their pastor, and they want to see their other friends that are spiritual and faith-based as well. And so all of those things provide tremendous meaning, support, and coping to those of you that are those people that are part of your congregation, and not to lose sight of that.
Thank you.
And I would say that just for the fact, Bishop Jim, that you're having this resource available to your clergy says that you value self-care for the pastor, that you value self-care, so that within staff, to encourage your staff to be taking care of themselves as well. And that's a trickle down. It trickles down from leadership. So for you starting this and encouraging us to have this training resource, this resource for clergy, says so much about your leadership within the diocese, and also your desire for your clergy to be healthy, and that clergy take advantage of that. Pastoral care people take advantage of this and seek help, seek counseling for you, so that you can then pour in all of Jesus out of you in such healthy ways to the people that you're ministering to.
Yeah, it takes healthy clergy to lead healthy congregations.
Yes. Mm-hmm.
Well, thank you both for your time and your expertise. This was great. I've learned a ton, and I appreciate your willingness to share all of that with us.
It's great. Thanks a lot.